You're watching the Randy Alvarez Marketing Report. I'm Randy Alvarez. Today's topic, how your image can have a huge impact on how your patients perceive you. And with us, we have Dentistry's image expert, Janice Hurley. Janice, welcome to the program.
Thank you. Nice to be here.
I'm excited about you coming here today.
Thanks.
You've given us some valid tips around here, walking in.
Either asked for or not.
That's right. It was very good. It's going to change the way I pose with my clients that come in here forever.
Okay.
I can assure you that. So for people that don't know you, who's the typical client and what are the different services you offer?
Yeah, that's interesting because like a lot of businesses, there isn't really a typical client, there's a variety. So it's individuals who are interested in being more effective, making sure that people perceive them in the very best light.
Okay.
Or sometimes they're companies. Companies like Wells Fargo or Boeing will hire me to help their individuals who've got great potential, but nobody's been able to address with them verbal skills, body language, or even attire, such as sports jackets and ties.
So not only do you lecture at big events, keynote, you go in the practices and work with these people.
Right. So it happens a couple ways. One is that individuals will fly into Scottsdale, Arizona, and they'll spend 1 or 2 days with me. Women often spend 2. Men never last more than about a half of a day. That's about all they need.
Okay.
And if they need coaching, verbal skills, we work on that. So we videotape maybe a phone conversation that we'd had so I can play back just the way it is that they're communicating. And the other way is to go into companies. So we'll go into a dental or a medical practice, and I go in quarterly. We spend a day and a half, and we have previously, or they have previously, done some actual taping of what their new patient exams are treatment consultations. Because the whole idea of my services is that your company is more profitable in the end, and you're perceived in the very best light. I think most of us have a really hard time seeing ourselves as others see us.
So you videotape them.
Ask them.
With patients, like with hidden cameras? Or?
Yeah, very good. It's actually done with the camera right behind the patient, and the lens is not on the patient at all. It's just on the staff member that's interviewing the patient, or it's on the doctor. So there's nothing about the team member. And we never use it outside of the training that we do within the office.
What do the doctors say, by the way? Like, what are some of the compliments that you hear?
That it's so much nicer now to go in and do a new patient interview or to do a consultation. They're much more relaxed. They realize after some training that they've been making themselves nervous and the outcome is so nice. And actually the number one most satisfying thing I get, they get to now do the dentistry that they want to do, or they're attracting the type of patient that they've always wanted. And they had no idea how important maybe that new patient interview and that interaction was. It's huge.
Who else is doing what you're doing? I don't think anybody else is doing what you're doing.
I actually don't know anybody else that's doing what I'm doing.
And you've been doing it for how long? Tell me a little bit about your history and your background.
All right. I started out 28 years ago as a business consultant for physicians in hospitals. It was rural hospitals that would hire me because they'd spend a lot of money recruiting physicians, and then they would pay everything for 2 years, and then they would leave because they didn't want to stay in that rural area because they didn't know how to run a business. So I would help them learn that. And then I eventually went into dentistry because managed care, eked in on the medical world, and dentistry was more about private enterprise. So I still work with physicians, maybe they're cosmetic surgeons or they're rheumatologists, anybody that has set up a boutique practice where they care about that one-on-one patient and attracting the right type of patient. And over the years, I was brought in to speak at large conferences on practice management. So I'd speak on computer utilization, scheduling, all the other things that other practice management consultants speak on. But one piece that I would talk about would be, I would show photos of before and afters of the doctor, before and afters of the staff, and the next time that the conference would hire somebody, me, to come back, they would ask me to speak on image. They would say, not anybody's talking about verbal skills the way you are, or body language, or the science of success. And
do you think that if you package a person properly, that you can increase the likelihood of the patient trusting the doctor, or liking the doctor, or moving forward with the procedure? I mean, are you of that belief?
100%.
Really?
100%. If they're interested. Sometimes there's
Do the doctors say that after using your services that their patient acceptance goes up?
Huge, without a doubt. In fact, many times that's the way I have gotten new clients. I had one of my favorite clients, Tom Franks, was in Bakersfield, California, and he is sitting next to another dentist, and they're attending a Frank Spear advanced course, right? And she's saying, all of this is great, but I'm never going to get to do this advanced dentistry. And Tom Franks hands Charlene Chu my business card and says, used to feel the same way. This woman will show you how to make that happen.
And as far as practitioners, you have kind of a small, medium, and large group practices?
It can be. It's anybody that's usually interested in doing better and willing. It's going to take a little longer for a larger practice, but a smaller practice, they really have to be willing to look at themselves. That means the doctor can't just videotape the staff members. The doctor has to start with herself or himself. And that treatment presentation and that new patient interview, that's crucial. That's where it all starts, right?
So you brought some photos.
I did.
What are we looking at?
We're looking at a very successful woman who was in IT, and she was ready to make a career move. She'd been successful, wanted to move out and do some consulting, and she had this nagging thought that she didn't quite look the part of being successful.
So she's a consultant.
She wants to be.
Was this the outfit she actually wore for consulting?
We're actually at her home, and I'm going to do a closet edit. And I said, show me typically what type of clothes you wear, and how do you look when you go to work now?
Closet edit, you call
Closet edit.
Okay.
She lived in Phoenix, Arizona, so I'm close enough to do that. So when she asked me what her potential was and what she could do, I knew within a tenth of a second. She was beautiful. She was amazing.
Do you see the end in mind?
Oh, absolutely.
Do you say, oh boy, this is going to be good?
Actually, when I see someone and I hear how smart they are, I'm wondering why don't they give that first impression that's consistent? It's that incongruity that makes me very uncomfortable. Because that's a smart woman with a lot of ambition. She's got very specific goals. She's written them down. And I'm afraid that first impression isn't going to be the best that it could be. But I knew it was a piece of cake. So within 8 to 10 hours, she looked quite differently.
Let's take a look at the after.
All right. There's the after.
Very nice.
How successful now?
Well, she looks like a business person, as a matter of fact.
Yeah.
Very interesting.
Thank
Very
you.
Interesting.
And what about attractive? How much more attractive?
She is at least, 10 times more attractive. But she looks like somebody that wants to be attractive. Whereas before, because you asked me, what I thought of her, and I didn't make an impression. As before, it didn't make it look like she wanted to be pretty.
Didn't look like she cared enough about herself.
Possibly.
Maybe. Or was
I don't know if I would think that deeply about it, but you're right. There's no doubt about it. Yeah. But now it's like a business person.
Quickly, though, what do you think I changed?
Well,
what do
her
you
hair.
See? Yeah.
Her makeup. She's wearing makeup.
Better makeup.
And her clothing. She looks thinner in the after.
Yeah. More structured jacket. That natural.
She's totally hip and up to date in the after.
Yeah. And dating somebody that she really likes now. And she launched her career as a consultant. She's doing very well.
Good for you. Okay, so other photos you have.
Yes. All right. So there you go. Young woman, but didn't look so very young. So what do you see when you see this particular woman, the blonde hair?
And you're asking me to critique it a little bit, but
just a little bit.
Turtleneck, and she just seems like an older woman.
Older. Okay. What does older mean to you? Approximately what age?
Well, not older. Older meaning 55, 60 years old. I mean, 70 is young today.
Yes, all right,
I'm fully aware of that.
I got that.
But I mean, she doesn't look like a 30-year-old.
Right.
Is what I meant to say.
So
older than me.
She's a dental consultant. She does speaking. She has offices hire her. And she had started to think that she was looking too old, that people wouldn't think she was relevant. So she flew in to Scottsdale. And one of the very first things I noticed was
do you have a studio, by the way? They fly in, they see you, they meet with you at your home.
Yes. They don't meet at my home. They fly in, and I have already analyzed their photos, and I have picked the right hairstylist for them. I've picked the right makeup people, and I've analyzed their body type, so I know what their budget is. They give me a budget, and I know what stores to shop with. So at the end of 10 hours, they usually stay over one more night in Scottsdale. It's beautiful.
Okay.
And then they leave the next day. So what I immediately noticed about her when she got off the plane, because I took that photo at the beginning, was that her clothes were too big for her. So I asked her, why do you wear this kind of big baggy jacket? And she said, because I have heavy arms. I said, really? So what happens is we often have records playing in our head that aren't very accurate. And hers was that she had heavy arms, when indeed she did not. And when I looked at her face, I thought with all that heavy makeup, she must have acne or something going on. And she didn't. She had beautiful skin underneath. So I always start with the hair. The color of the hair is dictated by the coloring on your skin. And then your shape of your face dictates which haircut or style will look best on you. So that's her before, and that's her after.
Wow. That could be her daughter.
A lot of people think that. So the same woman. So here's the number one mistake.
Very interesting. Good for you. This is a good one.
Thank you. A lot of
That's an extreme makeover.
Well, extreme, like you see on TV, they changed their teeth, or they did cosmetic. I didn't do anything like that. That's just hair, makeup, and the right clothes. That's just hair, makeup, and the right clothes within 10 hours time. That's possible for just about anybody. Pardon me?
What does she say when it's all done?
Oh, I can't believe that's me. I look so much younger, and I look so much slimmer. The right clothes made her look so much more slim.
I was around a negative person recently, and I didn't want to give my opinions here on the show, but I heard him say, the problem with makeovers, because I was telling somebody that you were coming on my show, is it wears off. But by looking at this, how could this woman go back to that?
I actually saw her at a meeting in Chicago, an AOSH meeting in Chicago, and it's been 7 years, and she looked exactly like she did in the after. They embrace it. It changes their life. People treat them differently, and they don't want to go back. No, they don't want to go back.
At the top of the show, and I will tell you that I was skeptical going into this, where you could increase your bottom line by your appearance. Patients will react to you differently. But I think anybody, if we show this on the screen, who looks more credible in this photo.
More current.
And hip. And her advice is probably going to be more relevant.
Exactly.
Maybe.
That's the problem with any of us looking too old or irrelevant. We think that others think of us that we haven't kept current. So
good for you.
That's a waste of time.
Okay,
it happens to the best of them. This is actually a physician. So there's his before. And this is an interesting story.
Let me take a look at this.
All right.
Okay. Looks like a regular guy.
So the gentleman to the left. So like a lot of doctors, he lives in scrubs, right? Most of the time. He is up for the position of chief of pediatrics for Kaiser Hospital, prestigious position. And he's been nominated by those that have worked around him already. But he realizes who's going to come interview him for this position is going to look at other people and then look at him, and he's not going to need to show up in scrubs.
Okay.
So what he does is he shows me what he wears for casual attire and what he does professionally. So we ended up...
How does he hear about you, by the way, this person?
People do web search. They'll put in professional image. Pardon me?
Wow.
Yeah, they'll put in professional image or executive coaching, and my name will come up. So he needed a casual look as well as a professional. So this is a casual look. I'm not going to show the professional look, but he got a great suit, learned how to take a great headshot, and that's the same man. Does he look more successful and more current than the before or the after?
I agree. The after, obviously.
Equally as smart. Right? Smart man. And the last one I want to show today, if I could, is sometimes conferences will hold a contest, and they will advertise for those that are going to attend the conference that there's a makeover competition. So people will write me ahead of time the reason why they would benefit from a makeover. And last week, the American Academy of Dental Office Managers did just that. We got about 50 people, women, applying, and they wrote a 100-word essay as to why they would benefit from a makeover. So there is your before. So think about this. All of the office managers are the people that either greet the patient coming in or present treatment presentation, or they're the ones that supervise the rest of the team. So they could be a small office, maybe 6 people, or they could be large, 30, 40, 50 people. And this is a first and lasting impression as to how successful that practice is and maybe the services that they would get. So when you're looking at that individual...
So that's the office manager.
That is the office manager.
And is that how she dresses?
That's how she dressed at work. So
does she want your help? I mean,
yes.
obviously.
This was her idea. These are people that have seen other makeovers I've done, and they're floored. They think this is the best thing.
They
scream
Janice
and
Hurley.
Yell when you call and interview them. Oh my gosh, no! They all know who I am.
Okay.
They've seen other makeovers. So,
all right.
Yeah. So she was about one of 50 applicants. She's a mom about 34 years of age with 3 young kids at home, and she's the office manager. And this was the interesting story. She was a new team member on board, and she felt that the rest of the team didn't quite respect her yet because she was the newest and possibly the youngest. So she thought that maybe if her clothes looked different, she'd have more confidence. So she flew into Scottsdale for her makeover, and that's the after look.
So is she going to wear a jacket every day?
Yes.
Do you suggest that they wear jackets?
Absolutely. I don't say that everyone always has to wear a suit by any means, because it's often a
what
little bit...
if they don't have the money for this?
Very good. Very good. I suggest that the doctor or the doctors as a group make sure to hire someone that initially has the attire that they need. So they have written protocols for it, which you can get on my website, so they can look at that. Or if you have an existing team member, understand that this is going to help your bottom line. I usually tell doctors allow about $500 about every 6 months, and make sure that they know.
Wow.
Yeah.
Good.
Think about that though. In 6 months' time, how much treatment could you get a patient to accept, and that that affects your bottom line. Because what is your perception of this practice versus on the before or the after?
Yeah. No, I mean, it's well put together.
It's how she feels.
She's happier. She probably feels better about herself.
Yes.
Maybe that rubs off a little bit.
She's shown.
I don't know.
The next day at the conference, she texted me and said that I'm sitting in the front row for the first time in my life at one of these CE classes. So that makes a huge difference.
Do you think that when you do this with one employee, that the rest of the employees want to pick it up a notch as well?
Oh, they do. They do. And she's the office manager. They're now going to respect what it is that she has to say. So if you have other team members in the front desk and you're wearing a blazer or jacket each day, you know that everyone else is noticing.